So to tell you the technical name of the project that we're working with, it's Lending a Hand to Take a Stand Against Cancer. And it is a pilot project, and we're working in partnership with our partners, the Northeast Cancer Center. So we wanted to give a bit of the remote northern experience to this pilot because it is very different in the north, and so it was important for us to engage with our community at a very different level. So Winnebago is one of the partners in the Northeast region, and I've listed the other partners, and so they actually incorporate the North Shore, Manitoulin Island, actually coordinate some of the urban population in Sudbury, but the focus is to work primarily with the First Nations populations living in those regions. And then of course, for us, it being an never screened pilot, we're also looking at opening it to our population of being the accessibility and dealing with remoteness factors. So obviously we understand the highest proportion of the population that we have is First Nations, but we also have our other population that we're definitely looking to service in this pilot too. So you will hear a lot of reference to First Nations, but it's open to our full community. The desired outcome for us in working in collaboration with Sudbury Regional Cancer Program was to actually look at increasing our screening rates for breast and colorectal cancer in the James and Hudson Bay region. One of the exciting pieces that we were able to get from this project is to actually hire somebody to work with us on doing that data capture for us and do those manual audits and go through charts each of our community sites to be able to collect that type of data so we have an idea of what our screening eligible population is. So, and another thing is to actually outreach with our communities. One of the things that we realized that if we don't engage with our communities effective enough, then anything that we do doesn't seem to get to the grassroots level as great as we want it to. So what we were hoping to do with this pilot is use community faces and community voices to be able to pass that message on to our own community members within this region. And then, of course, to educate our healthcare providers about what we do know about cancer and cancer screening and what they can do to help get our population and encourage them to go for screening. And then, of course, to create a culturally relevant and safe outreach campaign for this region in particular so that we can engage more effectively than what the current approaches that exist with our programs. So our WAHA locations, I'm actually happy to report, of course, the main site is Moose Factory. We have Moosonee involved. We have Attawapiskat and Fort Albany. And we went to Chief and Council in both Peawanuck and Saskatchewan and had their full endorsement to participate in this pilot. So we're happy to report that all of our communities within the region are actually participating with us and working with us in this pilot. So an eye into the community. So I want to talk and touch around the importance of cultural relevance, our geographical variances, the community support that was vital to us, as well as our community champions. So to get an eye into each of the communities and to get that community perspective beyond Moose Factory, we actually engaged with a working group, and some of them we have joined with us through OTN. But we have each of our sites, so I want to give special recognition to Weena, Rachel, who's here in the room with us, Crystal in Fort Albany, Delma in Attawapiskat, Scott in Cache, Elaine in Peawanuck, and Janice, who is here to join us as well, working with us around our database. So we're very pleased to have this working group work with us on rolling this pilot out to the grassroots level and to our community population. The screening eligibility in Ontario is between 50 to 74 years. So what does that mean? It means that for us, when we actually looked to developing a database, we looked between the ages of 48 years and the ages of 74, so that we can get those who are primed or soon to get ready to go into screening, and those who should be in the screening program already. And this is what we've been able to find out through Janice's data collection. We found out 476 patients are eligible for screening in Attawapiskat, 229 in Fort Albany, 520 in Moose Factory, 490 in Moosonee, Cache had 242 and Peawanuck had 50. One of the things that we did find out is there's still some data challenges. So this was the best we were able to do with the data that we had access to and availability to. It's the first time that actually gave us concrete numbers and people that we can actually target in the community to engage for screening. So if you'll notice in the top right-hand corner, we actually used Susan McLeod. She was a longtime employee of Winnebago Area Health Authority, and prior to that, Winnebago General Hospital. We used herself, so a community face, to actually educate women in the community about breast screening. And our tagline for that campaign was to put the squeeze on breast cancer. So we utilized herself, her daughter, and her granddaughter to actually pass on that message. If you go to our website, you will actually see posted to our website Lawrence Martin singing a song about colorectal cancer and educating the population about going for screening. So that was a little exciting for us, and that's going to be one of our TV PSAs that we'll play in each of the community sites. The other thing that we did is developed customized letters of invitation. So what we did is actually wrote on behalf of each of our communities and each of our sites, customized letters from each of those sites to the women or the men who should go for colorectal screening or breast, so that it comes from a health center that they can recognize and that they can resonate with. And if they have questions, they can actually go into their health center and discuss it. So that is something that we developed in collaboration with Sudbury to be able to do that. And then another piece that we're launching starting tomorrow is a community contest. So what we're hoping to do is to engage our population in dialogue with each other to talk about the importance of screening and to feel at least comfortable to go and talk to their nurses or our doctors, our primary care providers, and ask about screening and any questions that they might have. So then there's a comfort level to be able to say that this is an actually important piece of your healthcare and taking care of yourself. Some of the challenges that we saw when we actually engaged in a bit of doing a needs assessment with each of our healthcare providers and our health directors was finding out from them that we were great at handing out the fecal occult blood tests. So those are the parts of the tests that are tied with colorectal screening. Not so great in returning the kits. So what we're hoping to do is to use this community contest to encourage and have people come in to say this is a very acceptable part, and they're taking leadership in their healthcare and healthcare delivery. And in order to have them actually return the kit and just not take the kit, we're looking to do a community draw. So if they actually take the kit, complete the kit, and we see that it is good and everything is in check and we can send it through to the provincial-based program, then what they'll do is get a ticket, and we'll be holding community draws for prizes to be able to have people hopefully engage and view this as an acceptable behavior to engage in. Hopefully they will encourage their family members or their loved ones and friends who should be going for screening to go for screening as well. So if they bring in somebody or refer somebody, they'll get an additional ticket to participate in the contest. I had mentioned the community group that we had worked with. Well, with our community group, our working group, one of the things that we found out that was very important that didn't exist in a lot of the provincial-based materials that are available to educate the population right now is recognizes faces and leaders in our own communities. So this is what one of the things that we chose to do is to actually get recognizable faces from this region to participate in this. Recognized voices, so hopefully the voice of Lawrence Martin will be heard. We want to see those YouTube video numbers pump up, so please take a look at the YouTube video. Humor. We found humor was very, very big to our population to be able to engage them and to feel comfortable to talk about these sensitive topics. So to make light of it, but yet at the same time educate. So those were some of the things that were important to us when working at the grassroots and working with our community working group. And the other thing is to create systems that can complement our existing systems that work here already and not completely change what we had. Because some of the things that we found, just to even access some of the programs or the provincial-based programs like the colon cancer check, there were some things that the program just didn't fit into the realities of this community, but we were able to be flexible to fit in some of those variations that we do have in this community, but yet still be eligible to participate in the program. So we're very happy that Sudbury was able to work with us around that engagement to work out some of those things. Here's just a sample of some of our things. The invitation letters. We actually created tent cards, and we've worked with the community agencies in each of our communities. So now, for example, if you go in and sit in the Eco Lodge restaurant, there'll be a tent cart there set up on the table that will actually educate you about breast and colorectal cancer. You go across to the Sky Ranch, or you're sitting in the train station over there, they'll have these actual messaging. We worked with the planes, the trains, haven't hit the automobiles yet, we'll try that soon, I'm sure, to actually be able to put our leaflets in there. So, in other words, we want you to spread the word, not be afraid to talk about it, and tell others who should be screened, and even if you're not at screening eligible age, the other thing that we've learned that's so important to our communities is many times we're advocates for our own families, our own friends, our own loved ones, our parents, to spread the word to them. If your parents or your loved ones should be screened, please spread the word to them. And it's not about just only once you hit the golden age of 50 you talk about it. We're really strongly encouraging you to talk about it sooner rather than later. So with that being said, I'm actually going to pass it over now to Mark Hartman, who is the VP from the Northeast Cancer Center, and he'll share a few words on behalf of Sudbury.